A guide appears. In June 1978, my practice of medicine changed as a result of an unexpected experience I had at a teaching seminar. Oncologist O. Carl Simonton and psychologist Stephanie Matthews gave a workshop, Psychological Factors, Stress, and Cancer. When I looked around during the first workshop session, I was amazed and angered to find that I was the only body doctor there out of 75 participants. Those attending were mostly social workers, patients, and psychologists. I became even angrier when many of the participants told me they already knew about these techniques because the things I was learning hadn't even been hinted at in my medical education. Here I was, an MD, a medical deity, and I didn't know what went on in the head at all. I thought about the health records of doctors. They have more problems with drugs and alcohol and a higher suicide rate than their patients. They feel more hopeless than their patients and die faster after the age of 65. No wonder many people are reluctant to go to mainstream physicians. Would you take your car to a mechanic who couldn't get his own car to run? The Simontons taught us how to meditate. I sat down, closed my eyes, and followed directions. I didn't believe it would work, but if it did, I expected to see Jesus or Moses. Who else would dare appear inside a surgeon's head? Instead, I met George, a bearded, long-haired young man wearing an immaculate flowing white gown and a skull cap. As the Simontons taught us to communicate with whomever we'd called up from our unconscious minds, I found that talking to George was like playing chess with myself, but without knowing what my alter ego's next move would be. George was spontaneous, aware of my feelings, and an excellent advisor. He told me I could do more good by remaining a surgeon, but changing myself to help my patients mobilize their mental powers against disease. I could combine the support and guidance of a minister or psychiatrist with the resources and expertise of a physician. I could practice clergery, a term my wife coined. In the hospital, I could be a role model for students, house officers, and even other physicians. George said, "You can go anywhere in the hospital. A clergyman or therapist can't. You are free to supplement medical treatment with love or death and dying counseling." I suppose you may call George a meditatively released insight from my unconscious. All I know is that he has been my invaluable companion ever since his first appearance. My life is much easier now because he does the hard work. George also helped me to see that as far as healing is concerned, exceptions do not prove the rule. If a miracle, such as permanent remission of cancer, happens once, it is valid and must not be dismissed as a fluke. If one patient can do it, there's no reason others can't. I realized that medicine has been studying its failures when it should have been learning from its successes. We should be paying more attention to the exceptional patients, those who get well unexpectedly, instead of staring bleakly at all those who die in the usual pattern. A group for rule breakers. After my experience with the Simontons, with the help of my wife Bobby and Marcia Eager, then a nurse in my office, I started a therapy group called Exceptional Cancer Patients, or ECAP, to help people mobilize their full resources against their disease. We had sent out 100 letters to patients. The letter suggested we could help them live better and longer through the techniques ECAP would teach them. We expected hundreds of replies. I began to get nervous about how to handle the crowd that would appear. 12 people showed up. That was when I started to learn firsthand what patients are really like. I found there are 3 kinds. About 15 to 20% of all patients unconsciously or even consciously wish to die. On some level, they welcome cancer or another serious illness as a way to escape their problems through death or disease. These are the patients who show no signs of stress when they find out the diagnosis. As a doctor is struggling to get them well, they are resisting and trying to die. If you ask them how they are, they say fine. And what's troubling them? Nothing. In the middle of the spectrum of patients is the majority, about 60 to 70%. They're like actors auditioning for a part. They perform to satisfy the physician. They act the way they think the doctor wants them to act, hoping that then the doctor will do all the work and the medicine won't taste bad. They'll take their pills faithfully and show up for appointments. These are the people who, given a choice, would rather be operated on than actively work to get well. At the other extreme are the 15 to 20% who are exceptional. They're not auditioning. They're being themselves. They refuse to play the victim. I get many letters from groups called Aid to Cancer Victims or some such title. The first thing I tell them is to change the group's name, because victims, by definition, do not have the control they need to redirect their mode of living. Exceptional patients refuse to be victims. They educate themselves and become specialists in their own care. It takes courage to be exceptional. I remember one woman who, when told she had to go to the X-ray department, replied, "No, this test hasn't been explained to me." When the attendants told her, "You could die tonight if you don't have this test," she said, "Then I'll die tonight, but I'm not leaving my room." Immediately, someone appeared to explain what the test was all about. Physicians must realize that the patients they consider difficult or uncooperative are those who are most likely to get well. Psychologist Leonard D. Rogatis, in a study of 35 women with metastatic breast cancer, found that the long-term survivors had poor relationships with their physicians, as judged by the physicians. They asked a lot of questions and expressed their emotions freely. Likewise, National Cancer Institute psychologist Sandra Levy has shown that seriously ill breast cancer patients who expressed high levels of depression, anxiety, and hostility survived longer than those who showed little distress. Levy and other researchers have also found that aggressive, bad patients tend to have more killer T cells, white cells that seek and destroy cancer cells, than docile, good patients. A group of London researchers under Keith Pettingale recently reported a 10-year survival rate of 75% among cancer patients who reacted to the diagnosis with a fighting spirit, compared with a 22% survival rate among those who responded with stoic acceptance or feelings of hopelessness. To find out whether you have the outlook of an exceptional patient right now, ask yourself this question: do you want to live to be 100? In ECAP, we have found that the capacity to be an exceptional patient is accurately predicted by an immediate visceral yes, with no ifs, ands, or buts. Most people will say, "Well, yes, as long as you can guarantee I'll be healthy." However, the persons who become exceptional patients know that life comes with no such warranty. They willingly accept all the risks and challenges. They know that happiness is an inside job. When I ask for a show of hands on this question, the response is invariably the same, about 15 to 20% for an average audience. There are far fewer yes answers, only about 5%, in a room full of doctors. Medical students are not so hopeless. It is trained into us. It's a tragedy that so few doctors have the self-confidence necessary to motivate others to believe in the future and care for themselves. Healthcare providers are so used to seeing only illness and handicaps that they rarely have a positive attitude. When I go to a holistic health group or to a rustic area where self-reliant individuals live, almost all the hands go up. These are people who look to the future with confidence, knowing that respect and love are available at all ages. I feel that all doctors should be required as part of their training to attend healing services at which people with so-called incurable diseases appear. The physician should be told they are not allowed to prescribe medications nor consider operations for these people, but simply told to go out and help them. Then doctors would learn that they can help by touching, praying, or simply sharing on an emotional level. It would also help to organize annual parties for survivors of serious illness, so that physicians could see and talk with their successes, the people they've helped make well.